My name is Ashley Mills. I am currently employed as a cardiac cath lab nurse at Iowa Methodist Medical Center in Des Moines. I am also seeking my master's degree in nursing education. I chose to create a course for the cardiac cath lab nurses of the future. My idea behind this is that nurses who enter the cath lab often have minimal to no procedural experience and even state they have had minimal exposure during their nursing program. I believe that all specialties need more education while in nursing school, or a class that is designed for that specialty should be offered so that someone could take it once they complete their degree. I chose this topic because in nursing school there is limited exposure to procedural areas such as the operating room, cardiac cath lab, or endoscopy. We often have nurses who come for an interview in the cath lab but tell us they have no idea what we do. I feel that offering a cardiac cath lab in nursing course as part of an introductory course or an elective for pre-licensure RNs or an RN to BSN student or a post-licensure RN could allow nurses to have an idea as to what other jobs are out there outside of bedside nursing or clinic jobs. It also allows these nurses to have an idea of what is done in the cath lab and set them up for success as a cath lab nurse. The purpose of creating a cath lab specific course is to prepare nursing students with the foundational knowledge and practical skills needed to function in the cardiac cath lab. First, let's talk about our learning goals. The student will have knowledge of cardiovascular anatomy and physiology. The student will know medications administered in the cath lab. The student will demonstrate knowledge of standard diagnostic and interventional procedures. The student will recognize and manage common complications in the cardiac cath lab. The student will demonstrate knowledge regarding radiation safety and sterile technique. The student will demonstrate knowledge of hemodynamic monitoring and EKG changes. Next, let's talk about the outcomes for this course. The student would be able to describe the indications for a cardiac catheterization procedure. The student would be able to demonstrate sterile technique. The student will be able to interpret hemodynamics and EKGs in the cardiac cath lab. The student will be able to manage complications such as arrhythmias, codes, and medication reactions. The student will be able to administer medications safely. Next, let's talk about core elements of curriculum development, such as goals and objectives, curriculum design, implementation, and evaluation and feedback. We first want to determine the need and gain support for curriculum development. We will also need to designate a curriculum leader. Clear goals and objectives should be established to ensure that faculty and students are aligned on what will be taught in this course. Curriculum design is essential because we want to ensure that we cover all topics necessary for a successful future career as a cath lab nurse. Implementation is needed to ensure that we deliver the curriculum as designed. Evaluation and feedback are essential to determine whether the curriculum is effective. We want to assess student learning and ensure that we are meeting our program outcomes. Next, let's discuss the learning theory behaviorism, a method used for teaching clinical skills. There are different types of learning theories, but we're going to talk about behaviorism, where learners are rewarded with behavioral reinforcement, resulting with positive outcomes for good performance. In nursing education, behaviorism is facilitated by allowing nurses to practice their skills on mannequins, which enables them to use the trial and error method to acquire the desired skills. Satisfying results will lead to strengthening of a nurse's skills. In this course, the use of a mannequin in trial and error is very beneficial for new nurses when practicing their skills before applying them to real-life scenarios. The novice to expert theory outlines 5 levels of nursing proficiency: novice, beginner, competent, proficient, and expert, and it supports the idea that clinical knowledge is developed over time. While still a student and as a new graduate nurse, a nurse is considered novice. Novice meaning that they have no professional experience. I would like to create a cardiac cath lab specific course to help these nurses progress from novice to beginner to competent and so on. This course would not only be offered to students in a nursing program, but it could also be offered through the cath lab department to nurses who have no experience in the cath lab procedural area, critical care, or emergency room. The novice nurse would focus on basic knowledge and rules such as anatomy and physiology of the cardiovascular system, introduction to the cath lab and the procedures that take place, patient safety and infection prevention, and the roles and responsibilities of a cath lab nurse. This would be achieved through lectures, assigned readings, simple case studies, and skills lab focused on infection prevention and sterile technique. As a beginner, we would concentrate on recurrent situations and the need for clinical judgment, with an overview of contrast administration and radiation safety, interpretation of vital signs and hemodynamics, EKG changes and sinus rhythm, and a review of the diagnosis that led to the patients requiring a procedure in the cath lab. This training would be done through simulation of scenarios, time spent in the skills lab, and clinical shadowing. As the student moves from beginner to competent, they would begin to focus on case management, recognition, and management of complications, medications, and how an emergency situation flows in the cath lab. This content would be taught through case studies, simulations, and continued shadowing in the cath lab. A nurse is not necessarily going to be proficient or an expert once they complete this course. To become proficient or an expert in the cath lab, it takes years of experience, knowledge, and practice. Next, let's talk about another learning theory, experiential learning theory. Another learning theory that could be applied to this course is the experiential learning theory, which states that learning occurs through concrete experiences, reflection, conceptualization, and experimentation. This would be achieved through simulation labs, shadowing in the cath lab, case studies, reflective journaling, and real-life patient care scenarios. Clinical competence is of importance in this course because it integrates knowledge, skills, and judgment that are required of a cath lab nurse. Patient-centered care is the most important because it focuses on the patient's safety, dignity, and informed decision-making. Critical thinking is important in this course because it enables the nurse to make informed decisions in complex environments, such as the cath lab. The purpose of integrating curricular design is to develop evidence-informed, context-relevant, and unified nursing curriculum that builds students' professional knowledge and skills, enabling new graduate nurses to provide safe, high-quality healthcare to their patients and community. This course will be educationally sound, aligned with the program outcomes previously described, and support the students' development of their skills. Next, let's look at 5 teaching methods that would be beneficial for this course. The teaching methods I have proposed for this course are lectures, simulation, games, case studies, and problem-based learning. The first teaching strategy for this course is lectures. Lectures are one of the oldest teaching strategies available in the classroom setting. Lectures have several advantages, including the ability to provide information to a large group of students and cover a substantial amount of material within a given time frame. Lectures can also be cost-effective. Lectures are a great way to introduce new material, facilitate group discussions on the topic, and summarize course content, presenting large blocks of complex information. Lectures give students a passive, non-thinking, information-receiving role. With the advancement of technology, lectures can incorporate classroom polls, PowerPoint presentations, and other interactive learning tools to enhance the learning experience for students. Next, let's talk about simulation. Simulation is the art of recreating a real-life clinical scenario in a controlled setting and is an essential aspect of nursing curriculum. Simulations allow students to apply theoretical knowledge to real-life scenarios. Simulation is most useful because it mimics patient-centered care, allowing for a more direct application of knowledge than a lecture would permit. During these simulations, nurses would be able to develop their patient assessment skills, critical thinking skills, sterile technique, medication administration, development of teamwork, and other cath lab-related concepts. Third is games. Games are not only fun for students, but they are also an effective teaching method. Games increase the students' motivation and interest in the topic at hand. Games promote active learning, development of critical thinking skills, and simulate real-life situations. There is also an opportunity to combine games with the lecture to make the lecture more interactive for students. With the advancement of technology, games can be played using the student's phone, iPad, or laptop. Our fourth teaching method is case studies. Case studies are stories that present realistic, complex, and contextually rich situations and often involve a dilemma, conflict, or problem. Case studies are used to bridge the gap between theory and practice and between classroom and practice or patient care. Case studies assist in the student's integration and application of knowledge and skills such as clinical reasoning, critical thinking, problem solving in hypothetical or real-life scenarios. Case studies can help guide education during a simulation or be used in the classroom or online setting. The last teaching method we're going to cover is problem-based learning. Problem-based learning, which uses patient situations or scenarios to simulate students to acquire and apply information to solve problems. As an educator, I would present realistic situations to students, ask questions, and require the students to search for holistic answers. Problem-based learning improves clinical reasoning skills, increases retention of information and skills learned, and enhances self-directed study. Program evaluation is a common practice among higher education programs. Common indicators that are used to evaluate a program include student GPA, student performance on standardized exams, student retention, graduation rates, passing rate of the NCLEX exam, employment rates, graduate perceptions of learning experiences and the readiness for entering the job market, student satisfaction with program quality, graduates of self-reported competency, and the employer evaluation of graduates. A course evaluation I would use specifically for this course would include a survey of students who have entered a job in the cardiac cath lab to see if they felt this class prepared them for their position. I would also want to seek feedback from the student's employer to determine if the student was well prepared for their job as a cath lab nurse. Another evaluation tool I would use is how the student was progressing through Benner's theory, novice to expert, and ensure they are meeting the objectives as they move through this course. I want to ensure alignment with the standards set by the Accreditation Commission for Education in Nursing. An arm of the AACN, the Commission on Collegiate Nursing Education, ensures the quality and integrity of baccalaureate and graduate nursing education programs that prepare future students. The CCNE serves the public by assessing and identifying programs that engage in effective educational practices. I would also want to ensure that this course meets the Iowa Board of Nursing requirements for curriculum of clinical competence, falls within a nurse's scope of practice in the Iowa State Board of Nursing, and aligns with the Board of Nursing standards for safe medication administration and procedural knowledge. In conclusion, many nursing programs briefly discuss the careers that are available to nurses outside of bedside nursing and clinics. This course would give nurses the education they need to become a successful cath lab nurse. If a course like this were to be successful, other areas such as endoscopy or the operating room could create a curriculum for their specialty. The learning outcomes in this course are designed to ensure that novice nurses become successful cath lab nurses. The goals in this course are designed to ensure that nurses are successful upon completing this course. The use of various teaching methods is necessary to support the diverse needs of different types of learners to ensure their success. I hope to see more courses created like this one to help future nurses as they become successful in their role.